Today we're going to be speaking briefly about methadone. It's one of the medications used to treat opioid use disorder. Methadone has about 50 years of peer-reviewed research. Methadone is shown to produce significantly higher treatment retention. It lowers the risk of illicit opioid use. It greatly reduces your mortality risk, your risk of dying. It reduces criminal activity associated with drug use. Methadone lowers your risk of certain health problems, including HIV and hepatitis C. Methadone is a full agonist, means it binds to the opioid receptor. It has a half-life of approximately 24 hours, and this can vary from individual to individual from 8 to 59. There is no ceiling effect associated with methadone, and you see the full effect in about 5 days. Methadone is a central nervous system depressant, and caution must be used on those that take benzodiazepines or abuse alcohol. Current dosing guidelines tell us the initial dose is around 30 milligrams. It can be lower, could be 10 milligrams to 20 milligrams under certain conditions. That you are taking Xanax or you're abusing alcohol. Individuals 60 years old and above and those with certain medical disorders usually require a lower dose. The goal is for you to achieve stability for 24 hours on the lowest dose possible. What we mean by that, we don't want you in withdrawal and we don't want you to be sedated for a full 24 hours. The first 2 weeks see the highest risk of an overdose. You're going through withdrawal, you're not stable yet, you may be tempted to go out and use fentanyl or heroin or prescription opioids. You will greatly increase your risk of an overdose. There are some side effects to methadone. These are some of the most common: constipation, nausea, body sweats, decreased libido and sexual dysfunction in men, drowsiness, the absence of a menstrual cycle in women, weight gain, and excess fluid in the body. You probably also see a craving for sweets, which is associated with that weight gain. See, the typical stabilizing dose is around 60 milligrams. We see the greatest treatment retention at doses between 80 and 120. And longer stays in treatment equals superior treatment outcomes. Quitting treatment, however, is associated with increased risk of overdose and death. That's a very brief overview of methadone. Methadone is effective. Anyone that says otherwise is either ignorant of the research or just refuses to believe the research. Join me next time when we'll be talking about the buprenorphine. Thank you.